My project is on the physics of swim bladders and swim bladder disorders. So how do fish float? Most fish have an average density that is higher than that of water, so they need to adapt ways to achieve neutral buoyancy. There are several different ways that fish accomplish this, including active lift, which is an energy-intensive process that prevents sinking. This is seen in organisms like sharks and hovering gobies. Another way that fish accomplish this is through hydrostatic lift, which reduce the average density of the fish to make floating easier. They accomplish this in three different ways: swim bladders, lipid-rich livers, and reducing the overall mass of the body. This is usually in deep-sea fish like anglerfish. So what is a swim bladder? Swim bladders are hollow elastic organs that perform many different functions, including buoyancy and depth control, and sound production, hearing, and even respiration. And there are two main types of swim bladders: physostomus and physoclistus. Physoclistus swim bladders are the more common type of swim bladder. They inflate through the diffusion of gas from the bloodstream into the bladder. In order for gas to enter the swim bladder, higher pressure is created through a tangle of capillaries called the Raadt mirabile that increases pressure on the outside of the swim bladder, and pH is also changed so that the blood is less able to hold oxygen, so that oxygen is now able to diffuse into the swim bladder due to the increased pressure. In order for gas to leave the swim bladder, a sphincter controls the release of gas into an area of the swim bladder called the oval, which is right next to a blood supply, and here gas can exit through simple diffusion. This secretion can be a fairly slow process, taking up to 48 hours to completely fill the swim bladder. In organisms like catfish, they maintain neutral buoyancy by having a moderately filled swim bladder, which cancels out forced gravity with forced buoyancy, allowing them to maintain the depth that they're at. If they want to move up, they will need to secrete gas into their swim bladder, which decreases the average density of the catfish without changing its body volume, which increases the buoyant force. If the catfish wants to move down, it just has to secrete the gas outside of the swim bladder, allowing its density to increase on average, causing the gravitational force to outweigh the buoyant force. Physostomous swim bladders, on the other hand, maintain a connection between the swim bladder and the esophagus through a channel called the pneumatic duct. In order for gas to enter, fish actually have to surface and gulp in air through their mouth. And in order for gas to exit, the fish has to let out the air via either the esophagus or the anus. In reality, physostomous swim bladders use a combination of this pneumatic duct and the diffusion process of physoclistus swim bladders. This connection to the esophagus is actually an ancestral trait, although there is the benefit of rapidly increasing the buoyant force on the fish. Goldfish have physostomous swim bladders, and if a goldfish wants to increase the level at which it's at neutral buoyancy, it likely does not have the buoyant force available to it in its current average density, so it will have to apply active force to surface and overcome that gravitational force in order to gulp in air and fill its swim bladder. However, it will likely overfill its swim bladder at this point and be too buoyant, so the fish will actually have to let air out of the swim bladder either through the esophagus or the anus in order to produce neutral buoyancy through cancellation of force between forced gravity and forced buoyancy. Other aquatic organisms don't use swim bladders at all, like sharks, which have large lipid-rich livers that are comprised of lipids that have a lower density than water. This system has quite a few drawbacks, however. It's not as powerful as swim bladders, and also its buoyancy is linked to its metabolism, so if a shark needs to tap into its lipid stores, it reduces its ability to float. So for a shark to maintain neutral buoyancy, it will be assisted by the decreased average density due to its liver. However, it still needs to apply a constant force in order to maintain that level. If a shark wants to move down, all it has to do is stop applying that constant active force, and the gravitational force will outweigh its buoyant force, and the shark will sink. Swim bladder disease is a disorder in the function of swim bladders, which causes abnormal buoyancy in fish. There are two main types of fish that experience this: floaters, who have an overfilled swim bladder, and sinkers, who have an underfilled swim bladder. The majority have a separate underlying cause, which can be the eating of fish flakes, as it causes physostomous fish to gulp in air as they're eating. There's no one treatment for swim bladder disease, but treatments may include feeding changes, sometimes surgery, maybe to correct torsion, an obstruction, or fix a physical mutation. Or some people have even made homemade fish wheelchairs that assist fish in giving them increased buoyancy to allow them to float a little better. These are the citations I used for this project, and these are the links to all the images I used